Adelina Comas-Herrera. I have been in PSSRU since 1996, I think, which is a long time ago. And I first started working on making projections of future long-term care expenditure under different ways of financing long-term care for the Royal Commission, which reported in 1998. And that was, and I've been doing a lot of that ever since. It's grown a lot. It's also become, I think, what used to be a relatively obscure area of research has now become a lot more understood outside academia, and I think it's become very good at public involvement. I think it's one time when we all went on an away day for 2 days at Hythe at the Grand Imperial Hotel or something like that, and it was just very good fun. I have worked a lot on the financing of long-term care and making projections of expenditure under different scenarios about population trends, societal changes, economic changes, and different funding regimes. And we have made projections for a lot of people, the Department of Health, but also for charities, for pressure groups even, and also for the European Commission. I am extremely proud that we got funding for a new project called MODEM, which is modeling dementia, looking at care and costs and outcomes. And it is a project that I think is groundbreaking in many ways because it's bringing together projections of costs and outcomes for the first time for people with dementia. We have so far spent a lot of time projecting costs, and I think it's time to look at the outcomes too, and to think what kind of care we'd like in the next 30 years and how we're going to achieve it and what we need to have in place to get there. I think it has provided very good tools for decision making. It has also shown the importance of measuring outcomes as opposed to measuring process or cost, and looking at the impact of the way we spend money on people. So to help us make sure that we spend the money in the way that makes the best possible impact for people. It's something that policymakers are increasingly trying to do and trying to achieve, and I think we have made a very important contribution on providing the tools for that. Well, we used to just be here at the university doing our reports, and then we just send them off to the funder and hope that they would make up their minds, and maybe we'd send something to an academic journal and get it peer reviewed to make sure that it was in line with what other academics considered a good standard of research. Nowadays we do a lot more than that. Nowadays we make sure that our research is understood by everybody, not just people in Whitehall, and we make sure that the implications of it are also publicly known. So we have changed a lot the way we engage, and we are learning a lot from that, and we're benefiting hugely from having much better dialogue with people who are affected by the kind of research that we do. I would probably introduce a long-term care insurance system, social insurance, to make sure that everybody was covered and that we had a much more sustainable way of financing long-term care. I would commission, and that's very self-interest, research on the impact of caring, the cost of caring on families. And we already know a bit about it, but we think we don't know quite enough about the real impact in the long term, both for people of working age and people who've retired and who give their time. We don't know, for example, really very well how caring affects people's long-term health, because most surveys we have done have been too short. I think the main issue is an issue of funding. We have the new social care cap, which is an improvement in terms of protecting people from very high personal expenditure, but it doesn't really make a big difference in the amount of funding that's available to fund long-term care in total. And I think that as long as social care has to compete with other expenditures such as health, education, and so on, and it doesn't really have a dedicated source of funding, it's always going to be underfunded. It will still play the role of the Cinderella of the welfare state for the time being, and it is an increasingly important issue because we have more and more people living to old age and requiring care and requiring good quality care. And we need to make sure we have the funding in place to meet those needs. I think that if we make a good job at helping people understand the importance of funding long-term care collectively and understanding that it's a risk that if we bear it individually is always going to be very hard to make sure that we get good quality in it. If we don't make a good job of that, I'd say about 2. If we manage to change perceptions and even the ways in which people vote on policy, maybe we could have a better financing system that means that we'd have good quality care, and maybe then it would be an 8. So I think we have a lot of work to do to have a good care system.